Hello and good day everyone. My name is Siti Hajar Maulat and today I will be presenting on the role of self-awareness in promoting accurate clinical judgment among physiotherapy students and practitioners. As healthcare professionals, physiotherapists are required to make accurate clinical decisions to provide safe, effective, and patient-centered care. Therefore, self-awareness and critical thinking are essential skills that help improve clinical reasoning and professional practice. What is self-awareness? Self-awareness refers to the ability to recognize and understand our own emotions, thoughts, behavior, strength, and limitation. In physiotherapy, self-awareness is important because it helps us reflect on our actions and make objective decisions. It also allows us to recognize our own biases and limitations, which encourages continuous learning and professional development. For example, a physiotherapist who recognizes personal bias is less likely to misjudge a patient. Therefore, self-awareness serves as the foundation for effective clinical judgment and patient-centered care. The importance of self-awareness in physiotherapy. Self-awareness plays an important role in physiotherapy because it influences clinical reasoning and decision-making. Without self-awareness, physiotherapists may allow personal assumptions or emotion to influence treatment decision. For example, assuming all elderly patients have poor mobility may result in inappropriate rehabilitation goals. Instead, physiotherapy should perform thorough assessment and treat patients based on their individual abilities. Therefore, self-awareness helps reduce bias, improve communication, and contributes to better patient outcomes. Critical thinking strategies. First one is the reflective practice. Reflective practice involve evaluation. Sorry, reflective practice involve evaluating our actions and experiences to identify areas for improvement. For example, after treating a stroke patient, a physiotherapist may reflect on whether the selected balance exercises effectively improve the patient's mobility. If the patient shows limited progress, the therapist can modify the treatment program accordingly. Therefore, reflective practice promotes lifelong learning and strengthens clinical reasoning skills. Strategy number two is evidence-based practice. Evidence-based practice combines current research evidence, clinical expertise, and patient preference when making treatment decisions. For example, when managing patients with low back pain, physiotherapy should use interventions supported by scientific evidence instead of relying solely on personal experiences. This approach helps improve treatment effectiveness, enhances patient safety, and promotes better rehabilitation outcomes. Another important strategy is feedback and collaboration learning. Constructive feedback from supervisors and peers helps physiotherapists identify mistakes and improve their clinical reasoning skills. For example, during clinical placement, supervisors may provide guidance on assessment techniques and intervention planning. Collaboration with other healthcare professionals also encourages knowledge sharing and promotes continuous professional development. Ultimately, feedback and collaboration contribute to a better patient care. Although critical thinking is essential in physiotherapy practice, several barriers may affect clinical judgment. These barriers can be categorized into cognitive barriers, emotional barriers, and contextual barriers. If these barriers are not recognized, they may lead to poor decision making and negatively affect patient outcomes. I will now discuss these barriers in more detail. So the first barriers is the cognitive barriers. Cognitive barriers include confirmation bias, assumptions, and lack of knowledge. For example, a physiotherapist may assume that all athlete knee pain is caused by ligament injury without conducting a comprehensive assessment. This may lead to misdiagnosis and inappropriate treatment, and also delayed recovery and reduced treatment effectiveness. Barrier number two is emotional barriers. Emotional barriers such as stress, anxiety, and burnout can also affect concentration and clinical reasoning. For instance, a nervous student may be in a rushing or may rush through an assessment and overlook important findings during their clinical placement. Therefore, both of the cognitive and emotional factors may compromise patient safety and treatment effectiveness. Barrier number three is contextual barriers, which are the external factors that influence critical thinking. Example, therapists in overcrowded outpatient departments may not have enough time for a detailed assessment. As a result, important clinical findings may be missed, leading to ineffective treatment and delayed recovery. Therefore, the clinical environment can significantly influence clinical judgment. Next will be the influence of the culture on critical thinking. Culture also plays an important role in clinical judgment. Different cultures may express pain and illness differently, and language barriers may affect communication during assessment and treatment. For example, some patients may prefer passive treatment methods than active rehabilitation exercises. In physiotherapies, if a physiotherapist fails to understand this belief, misunderstanding may occur and patient compliance may be affected. Therefore, developing cultural competence through active listening and respectful communication can improve trust, patient engagement, and treatment outcomes. In conclusion, self-awareness plays an important role in promoting accurate clinical judgment among physiotherapy students and practitioners. Critical thinking strategies such as reflective practice, evidence-based practice, and feedback contribute to effective decision-making and quality patient care. However, cognitive, emotional, and contextual barriers may affect clinical reasoning if they are not recognized. In addition, cultural competence is essential for provide patient-centered care. Therefore, physiotherapists should continuously develop self-awareness, critical thinking, and cultural competence to ensure safe, ethical, and effective practice. Here is my references for this presentation. Thank you for your attention. Goodbye.